Depression, I think, is marketed to men. Instead of being depressed, I'm gonna fix those areas. I don't have time to be depressed.
What? Bro, what are you talking about, man?
Okay, y'all, so there's nothing wrong with your accounts. This is a video that I felt it was important for me to stitch. So, first off, to the person whose video I stitched, it is clear that you do not understand what depression is, so allow me to reintroduce myself. No, I'm just kidding. But my name is Dr. Raquel Martin. I am a licensed clinical psychologist, professor, scientist, professional speaker, and podcast host that specializes in Black mental health. In short, I does this.
It's about to go down.
So I wanted to hopefully provide you with more context using your words to help both of our audiences who came across this message. And I'm going to break it down according to misconceptions, because there are many.
Depression, I think, is marketed to men, right? I think when you market something negative to people, that can be a potential out for not ideal behavior or ideal output or productivity. They're going to attach themselves to that negative thing. I don't relate to depression, right?
So, misconception 1. Depression is a complex mental health issue. It has never been a choice or a marketing gimmick. It is a medical condition influenced by biological, psychological, environmental aspects. Depression is the result of internal and external factors, not just situations like money or relationships. The statement that you made really enforces the harmful stigmas about mental health that myself and a number of licensed mental health professionals and advocates are fighting so hard to combat each day, especially in the context of masculinity. What you're doing promotes the dangerous idea that men should suppress or ignore their mental health issues. And it's so disappointing to hear from a Black man.
Damn!
Because you could be a mouthpiece for change in the right direction, especially given your following. But in this instance, sir, I actually consider you to be part of the problem. Now, as someone who specializes in Black mental health, this perspective is particularly damaging in the Black community, where mental health issues are often under-discussed, undertreated due to stigma perpetuated by messages such as this one, and lack of access to culturally appropriate care. Now, I looked at your comments that you made, and I saw this as a response to what someone else said. And there's also so many issues wrong with this, but I'm just going to name a few. One, you misrepresent depression again, which makes sense because you don't quite understand what it is. You only place emphasis on like personal agency when it comes to depression. You indicate that it's solely a choice. Also, the dichotomous language you use, talking about you're either victim or victor, is stigmatizing, insulting, and incredibly limiting. And I don't appreciate the complete and utter disregard you have for the level of impact and hold that depression can have on you and any individual, on a family, and a community. It's not simply about the lack of space to manifest or the lack of intellect and the lack of power. Depression can profoundly impact someone's motivation, ability, biological implications, everything, regardless of how much willpower they have.
What's going to make someone depressed? Is it like spouse? Is it work? Is it lack of money? All right, instead of being depressed, I'm going to fix those areas, whatever it may be.
Here's another misconception you put up there. With this statement, you fail to consider the other contributors, the other factors that contribute to depression, and a wealth of other mental health diagnoses. Because I would also like to say that depression is not the only mental health diagnosis. You're not considering like systematic issues like racism and poverty and inequality that contribute to mental health challenges, especially among Black men. One of the reasons why I always advocate for liberation psychology is because it emphasizes the understanding of individuals within their socio-political and cultural context. This perspective that you gave ignores the complex interplay of personal, societal, historical factors impacting mental health. And once again, I totally understand how you could miss this because this is not your level of expertise.
The jacket looks great. Yes. I don't know what you're talking about, but every woman in here is gonna like that. Please, you wore a jean vest.
However, there seems to be a great disconnect with people thinking that just because you get asked a question, you need to answer it. That's not accurate at all. Let's move to the next misconception.
I don't have time to be depressed. You feel me? And that's a decision. People gotta understand that.
Okay, this is bing. This is the next misconception, and honestly, I don't know if this was the one that infuriated me the most. It was the most concerning for me because once again, the pure oversimplifying of pretty complex concepts, which once again I expect you to do because you don't understand them. One being trauma and the profound impact that trauma can have on one person's emotional and mental well-being. Trauma can't just simply be boiled down to overcoming challenges or becoming great. It's not simply that someone can just decide not to experience it.
Hey, yo, hey, niggas get shot every day, B. You be aight, nigga. You tough, right?
And truly, you think people just don't have the willpower to overcome mental health difficulties? As someone who does the work on all levels, science professor, psychologist, who's seen the triumphs that people made, the lapse, the relapses, the leaps, this is really insulting to hear because as someone who's out there in the trenches with my patients and my clinicians and training individuals and working with people, I have to say, how audacious of you. How insulting. Work harder, choose better. What?
Stop being a bitch and come on.
Recovery is a complex process. Also, I really hate that your perspective likely discourages Black men who already face barriers to accessing mental health care from seeking the help that they need. I really get upset at this because everything I do is to make Black people, he, she, and they feel more seen and create spaces to help them advocate for themselves, to feel more empowered and emboldened. And even I see people, every time I see people severing that trust that I hope to build within our community to support them, I get upset. I get upset. Yeah, let's move on to the next one.
So in the Superior Man Mentorship, my mentorship program, we're teaching men to calibrate their perspective and say, fuck that shit, fuck being sick, fuck being depressed, fuck having trauma, right? We take all of that shit and we use it to our benefit. The more stress, the more formidable the opposition is that you face, the greater it is, the greater you have the opportunity to become. When you're standing up against great opposition, you have the opportunity to be great, or it's gonna beat your ass and crush you. You're a loser. So, you know, if you want to be in that category of men that conquer their demons.
Finally, your encouragement to conquer the demons without addressing underlying mental health issues is going to lead to harmful behaviors and avoidance of seeking help. A better approach would involve acknowledging vulnerabilities, understanding emotions, seeking appropriate mental health support when needed. This aligns once again with the principles of liberation psychology, and I'm using these terms so you can look them up. Liberation psychology, which advocates for empowerment and holistic well-being, which nutrition stuff will be integrated in that. In this section, you truly make it seem like increasing levels of stress will always lead to greater opportunities for personal growth, and that's not true. Chronic stress can lead to significant physical and mental health problems, so not just opportunities for greatness. Chronic stress is the stomping ground for burnout, anxiety, depression, physical health issues. Your narrow view of masculinity implies that men should always be strong, unyielding, and unemotional, which is unrealistic, restrictive, and detrimental to their well-being. Once again, the community that I'm seeking to serve, I think you're attacking them. Also, sometimes I hear people have this whole survival of the fittest mentality, but all that does is create an environment where people feel pressure to constantly prove their strength and resilience, often at the expense of their well-being. When you think of Black Superwoman syndrome and the typical hallmarks, think of John Henryism. That is what it is in Black men, and both are detrimental. Once again, I'm using these terms so you can look at them up and educate yourself.
Take a look, it's in a book.
Okay, so last part. And I know this was a long one, y'all, but I just really felt that it needed to be said because I felt that this was like a really detrimental video. And I'm going to address this just because I'm sure I'm going to get messages about this. I don't think your intention is malicious or harmful. However, I think the impact of your message is harmful and detrimental for the community that you appear to want the best for. Intent and impact have and never will be the same concepts. Never will be the same concepts. Your viewpoints are just simplistic. They're too simplistic, and they reinforce harmful stereotypes. And to anyone who says, well, he was asked, I would say, know your limitations when you answer anything. I am under the impression that your platform started off being about nutrition, and weightlifting and boxing. And if I got asked questions about such topics, I would defer to individuals with expertise in those topics, such as you, right? But in this realm, no. Also, please comment below your thoughts on the topic, and to anyone watching, please let me know if you'd like me to post something dedicated to highlighting licensed mental health professionals that I follow who could provide you with more information about mental health from a well-educated perspective, from research and practice with hundreds and thousands of people, not from an individual's perspective. Most of the times, I really think people feel like justified in discussing mental health and generalizing these opinions as facts and as theories, which they're not, by the way. They're simply opinions. You're just opining all over the place. But the reason why so many people feel justified in doing this is because you're under the misconception and the myopic view that psychology is folk wisdom. And it's not. It's a science. I'm a scientist. Also, stuff like this really gets in the way of real coaches, because coaches have their role too, who do this and know what they're doing, being held accountable or just being held up. I hope you saw that thing that SZA posted about she thought she was seeing a therapist and she's seeing a coach, and it led more harm than good. My work is a science. Licensed clinical psychologist, licensed in over 30 states, published scientist. You can look me up. You can look up Mac or Martin. You'll find my articles there. I am a professor. I also teach clinicians. I'm also a podcast host and professional speaker. My work is a science. And the only reason why I make it seem simple is because I'm so good at breaking it down for you.
It's getting too loud.
I hope this helps anyone who watched that video, because I know this was a long one. And I think y'all deserve individuals who break down points. This is not me attacking this individual. I truly see this as, you don't know what you're talking about. But when I don't know what I'm talking about, if I don't know what I'm talking about, I don't say anything. There seems to be this aspect of thinking that because you're asked every question, you should just answer it. It's one thing to feel as though you are answering the question off of your individual perspective. Be like, from my perspective, I see it this way, but once again, I'm no scientist. From my perspective, I see it this way, but once again, I'm no expert. I think more of y'all need to get used to saying that, right? But I want to clarify, because a lot of people get this confused. Licensed mental health professionals, scientists, individuals who have expertise are not speaking from their own individual perspective. I am not speaking from my own individual perspective. I am speaking from the perspective of myself as a scientist who has thousands of clinical hours, worked with hundreds of patients, hundreds upon hundreds of students, actually thousands at this point. It's not just my perspective. You are being privy to access to the perspective of someone who works in a realm of science, education, clinical work. So once again, I does this. I hope you learned something from it. And once again, I do not think it was malicious. I don't have any problem with you. I do have a problem with the message that you provided, and I feel like it attacks my people. And I'm gonna always have a problem with that. But not you individually. I don't know you. So anyone who come in here talking about anything foolish,
Hey, start no stop, must be no stop. Hey, start no stop, must be no stop. Hey, start no.
please realize that my being a psychologist is what I do. It's not who I am. Don't talk to me crazy. I hope you enjoyed the video.
Dr. Martin here.